A 42-year-old pre-migrant woman presents to her gynecologist for a routine prenatal visit at 11 weeks of gestation. Her pregnancy has been uneventful so far. She denies smoking, using alcohol, or any illicit drugs. Past medical history is significant for Hashimoto's thyroiditis, which is well controlled with levothyroxine. Her blood pressure is 110 70 millimeter Hg, a heart rate of 95 per minute, a respiratory rate of 20 per minute, and a temperature of 36.4 centigrade, 36.4 degree, 97.5 Fahrenheit. Physical examination is unremarkable. A transvaginal ultrasound reveals increased nodule translucency. Laboratory studies show decreased levels of PAPPA and increased level of beta HCG. If the pregnancy is continued to term, the child is at an increased risk of developing which of the following conditions? Option A, vaginal adenosis. Option B, Huntington disease. Option C, Alzheimer's disease. D, Epstein anomaly. E, ulcerative colitis. The correct answer is C. The lab work for this patient increases the risk of having a child with Down syndrome. Patients with Down syndrome have an increased risk of developing Alzheimer's disease. Routine prenatal testing in the first trimester involves the measurement of pregnancy-associated plasma protein A, PAPPA, free beta human chorionic gonadotrophin, beta HCG, and fetal nodule translucency thickness. Non-invasive first trimester screening is particularly beneficial for the early determination of fetal aneuploidies, particularly trisomies 13, 18, and 21 as shown in the table below. Trisomy 13. PAPPA decrease, free beta HCG decrease, nodule translucency increase. Trisomy 18. PAPPA decrease, free beta HCG decrease, nodule translucency increase. Trisomy 21. PAPPA decrease, free beta HCG increase, nodule translucency increase. decrease the levels of PAPPA in association with increased levels of HCG and increased natural translucency highly correlates with Down syndrome. Trisomy 21, which is one of the most common chromosome abnormalities, it is the most common cause of intellectual disability worldwide. The characteristic of Down syndrome can be summarized in the table below. The cause of Down syndrome, non-adjunction, most common cause, 95 chromosome 21 fail to separate during lobotomy translocation, 4% of cases. Acrocentric chromosomes break at their centromeres, and the long arm fuse to the single large chromosome with a single centromere. Mosaicization, 1%. Patients have two distinguished. This is not correct. The epidemiology is 1 versus 700. Risk factors include advanced maternal age. Clinical characteristic, intellectual disability, low-set dysmorphic ears, epicanthus, blepharitis, conjunctivitis, brush field spots, single transverse, plasma crease, short, broad hands, muscle hypotension. Complications include congenital heart abnormalities, for example, endocardial cushion defects, duodenal achasia, The prevalence of Alzheimer's disease in Down syndrome is approximately 50%. This can be explained by the fact that the APP gene, which encodes the amyloid precursor protein, is located in chromosome 21. Cleavage of the amyloid precursor protein leads to the production of A-beta amyloid. Deposition of amyloid plaque in the brain is a classic histopathological finding in patients with Alzheimer's disease. Actual material from chromosome 21 leads to excessive production of A-beta amyloid, which when accumulated can lead to early onset Alzheimer's disease. Option A, vaginal adenosis, is associated with maternal use of the medication diacylstilbestrol during pregnancy. It is not associated with Down syndrome. Option B, Huntington disease is an autosomal dominant disorder which is caused by expansion of the CAG trinucleotide repeat of the gene encoding the protein huntingtin on chromosome 4. It is not associated with Down syndrome. Option D, Epstein anomaly, a atrialization of the right ventricle accompanied with anomalies of the tricuspid valve is associated with lithium intake during pregnancy, not Down syndrome. Option E, ulcerative colitis is an inflammatory bowel disease of unknown etiology. It has not been found that individuals with Down syndrome are associated with increased risk for developing ulcerative colitis. Learning objective: as patients with trisomy 21 are at increased risk for developing early onset Alzheimer's disease.